Alright, today we're going to be doing the heart exam. So I'm going to start by just looking at the hands. If you could show me your hands, looking for any cyanosis, nicotine discoloration, splitting hemorrhage, or anything else with the nails, and everything looks fine there. So from then, I'm going to do the jugular venous pressure, so if you could look that way. Then I'm looking for the highest point where I can see, or the lowest point where I can see the blood kind of pooling in the veins here in the neck. And then from there, I'm going to set my measurement at the angle of Louis here. And then with another straight edge, I will measure the height of that column of blood, which in his case was about 1.8 centimeters, which is perfect. From there, I will go on to general observation of the chest, looking for diameter, any skin discoloration, and then I'm going to start looking with the pen light obliquely at the different points of the chest for heartbeat, and then I'm going to check the apical heartbeat, which is the main spot where I should see it, and I see it there, so then I'm going to move on to palpation. I'm going to palpate the apical heartbeat here, and that feels normal to me. From there, and that's it for palpation. And then I'm going to move on to percussion. So for this, I'm going to have you lift your arms so that I can get into this space. And I'm going to start in the third intercostal space and just go from resonance to dullness until I feel the heart, which there it was mid-clavicular. Then I'll move down to fourth intercostal space, and then there, and then fifth intercostal space. And that looks good there. From there, I'm going to move on to auscultation. So auscultation, I'm going to start with the 5 points with the diaphragm. Use the bell. Everything sounds good there. So from there, I'll move on to special tests. So I'm going to have you sit up, please, for me. And if you could lean slightly forward, I'm going to look for aortic regurgitation right now with the diaphragm. And then if you could exhale all the way. So there I'd be looking for the lub-pu noise, and I didn't hear any of that. Now I'm going to look for some things with the mitral valve. So first I'm going to go to that apical impulse point and have you breathe in and out all the way. Okay. And then I'll have you perform the Valsalva maneuver with that same position. All right, and you're good to go.